Okay, Moi from Finland. Welcome back for what is now week 2, second vlog of the series. Obviously, last week was more just about talking about my sort of pre thoughts before going out onto placement, things that I was kind of feeling about what I might expect to see, and kind of how that or what that would perhaps make me think about this week. Obviously, first week down, first week under the belt. Some really interesting learning points. Lots to really kind of get you thinking about the differences, particularly in mental health care from obviously back home in England to over here in Finland. Thought this week perhaps maybe try and pick on 3 things in particular. I think the first one, having done a bit of pre-reading, is around legislation and the law. The second one would be a bit of a wider picture. Perhaps some observations in terms of kind of healthcare and perhaps kind of the picture of healthcare sort of overall perhaps. And then thirdly, after a couple of discussions this week, looking at and talking around about the attitude towards medication from people in mental health in Finland. So yeah, I think first of all, looking at legislation. Obviously, I think for those who are familiar with it, England has probably quite a lot of legislation regarding healthcare and mental health. Obviously, we've got the Mental Health Act, obviously with things like the right to appeal, right to an advocate, nearest relative rights, etc. Obviously, we've got the Equality Act, which obviously talks about treating people equally and individually, and obviously duty to make adjustments. And obviously, we've got the Care Act, which obviously puts duty of the local authority to provide sort of information and advice generally, and kind of making sure that people are cooperating generally in terms of organising care. In comparison to Finland, Finland have their own mental health act. They have like a 3 point kind of like 3 points to their mental health act, which are to be detained against your will only if you are found to be mentally unwell, if the community would likely worsen your illness or your safety, and also if all other mental health services prove to be unsuitable or insufficient. They also have the Act of the Status and Rights of the Patient, so an actual legislation for the kind of patient themselves. Within that, talks about things like rights to good health care, patients' right to self-determined care and treatment, and also right to be informed. I haven't included things like the Capacity Act or perhaps like disability, or kind of other acts that may include sort of things like disability and stuff. But yeah, I think generally sort of my thoughts on the differences perhaps is, I think the first thing that kind of stands out is perhaps the difference in tone of the policy. I think very much in England, UK policy sometimes feels a little bit kind of, it's almost like a you will be, or it's already kind of decided, whereas the way that kind of the Finnish Mental Health Act is wrote feels a lot more relaxed. For example, it says in there about if there's no alternative, and obviously the fact that there is choice. I think as well, in some aspects, maybe Finland appears a little bit more patient-centred in their legislation, kind of talking around patients being given choice. That's kind of legislated, whereas in the UK, I think probably unless I'm wrong, it's perhaps maybe more of something that's recommended as best practice and not kind of kind of written within law. And I think as well, just based on that, the idea of choice and and how that difference, maybe how does that impact on the patient or the service user's experience? Probably leading me on to my next point, but kind of thinking about like autonomy and patient choice, patient respect and dignity. Obviously that being a huge kind of huge point within mental health care, especially. So moving on to my second topic, which is looking at the kind of wider picture of healthcare, and a couple of observations. Again, bit of a comparison. Obviously in England we have primary care, which leads into sort of secondary care. We have tertiary tertiary care like specialist units, and obviously we have sort of social care and other services. I think obviously Finland have sort of a very similar sort of framework or system, if you will. But yeah, I think probably the thing that sort of stands out within the kind of system, and obviously, you know, kind of going back to the legislation side of things, is that idea of choice and people having a choice in kind of what it is that they perhaps need. I know there's at the moment there's going to be a change in the legislation with regards to your choices around public and private healthcare, which sounds quite interesting. Hopefully I'll learn a little bit more about that. After doing some reading, some general observations from a document that I was looking at. UK spent 31.1% of GDP on social protection, whereas in Finland they only spent 26.3% overall. And I think obviously in mental health as well, there's a large reduction in the number of care days per year. Literature suggests a move towards patient autonomy, with ideal of people continuing normality, for example, working, which I thought was quite interesting in terms of kind of, you know, we have, huge issues in England with people kind of, being within hospital settings for long periods of time. And kind of from what I was reading, it looks like Finland have tried to move away from that and actually get people kind of actually back into their perhaps kind of normal settings, and kind of maybe trying to get people into perhaps kind of normal life away from the hospital setting, which is an interesting thing. Cannabis rates compared to the UK quite low in Finland, but the main issue was alcohol, and I think from World Health Organization report indicate that UK has slightly worse alcohol consumption rates overall compared to Finland, which is quite an interesting fact, I thought, given that alcohol consumption here in Finland is an issue, as a bit of a comparison. So moving on to the last one really is attitude towards medication. Kind of included this because talking to some of the nurses around kind of England's, perhaps not necessarily just methods, but certainly kind of, you know, our culture towards what we perhaps see as kind of, you know, we have kind of chemical restraint. Also kind of, we do have like isolation rooms and things in crisis wards, but in sort of comparison, over here in Finland they have isolation rooms. I was told that in some cases people have been in the isolation rooms for about a week was an average, but somebody had been known to be in there for up to about 2 weeks. Obviously, kind of in comparison to maybe at home in England, I think that would be certainly seen as very, certainly seen probably quite negatively, you know, very differently. But at the same time, there was quite an interesting discussion around, in Finland they still have like bindings, like for your wrists and for your ankles and such. And when I was sort of talking about how people in England may see that as kind of a little bit inhumane, it kind of sparked quite an interesting discussion around which is worse, physical restraint or chemical restraint. Certainly given kind of, you know, the effect of the trauma is probably the first thing that springs to mind around chemical restraint. Kind of some people have suffered sort of, you know, really quite harrowing experiences through that. But yeah, I think kind of just the difference in how kind of nurses over here were sort of quite, not necessarily pro kind of restraint, but certainly probably would have seemed as if they would have more preferred restraint as opposed to kind of, you know, kind of chemical restraint. So yeah, kind of just leads you to sort of think about perhaps, you know, what we do back home, and certainly for me as a trainee nurse moving into mental health nursing post kind of August this year, you know, and thinking about the difference in those things and the effect it has on kind of people in care really. So yeah, I think that's pretty much it for this week. Obviously, quite a number of different thoughts there on a couple of topics, but yeah, certainly been a great week for learning for myself, and hopefully, if you've been watching all the way through, it's been interesting for yourself. More than happy to take recommendations for things you might want to know. So if you do, feel free to make a comment on the video and let me know. Okay, thank you.